If one of my patients has a Swan-Ganz catheter, or I'm just trying to think of how the right side of the heart functions, I usually like thinking about an analogy. And in this case, I use an old timey wooden ship. And this old timey wooden ship is headed to Pulmonary Artery Island. And what's it going to do at Pulmonary Artery Island? It's going to try and get some booty. And that booty is left atrial pressure numbers, or to see how the left atrium is doing. But in order to get to Pulmonary Artery Island, we have to start in the SVC, or the superior vena cava, usually. And we're going to start at the SVC and head down to right atrial lagoon, or the right atrium. And around this area is pretty chill pressures, anywhere from 2 to 12. Think CVP numbers, central venous pressure numbers. And we're just chilling, and it's a nice, smooth sailing ride. And then we get to Tricuspid Peninsula, and as soon as we pass Tricuspid Peninsula, those pressures seem to drastically increase precipitously. And they almost double. They're anywhere from 15 to 30. Now we're in the right ventricle, and we're going up, 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 and those pressures are staying about the same. And we're headed to pulmonary artery, and those pressures are going down a little bit, but not too much. They're about the same. But then we get into the pulmonary artery right about here, and then this ship has an ace up its sleeve. It smashes itself right into one of those arteries and inflates those sails even more, bringing up those balloons to inflate. And then it wedges into the pulmonary artery and grabs left atrial pressures, and then immediately deflates, and then heads back to smoother, more chill. So back to the right atrium to chill. Next time you're using a Swan-Ganz catheter, think of an old-timey ship headed to Pulmonary Artery Island to get some booty. Hope this helps. Follow along for more.